In today's Health Matters on Midday, Dr. Richard Ferguson tells me what we should focus on.
I'd have to say, let's start with what's most easily communicable, and that is cold and flu prevention. So I would say, first off, get vaccinated. And if you can, if you're someone at risk, particularly if you're over 60, pregnant, or you're going to be near infants, also getting a COVID booster. And then additionally, and this is something that many people may not know about, RSV vaccine. And that particularly is for adults that are 50 and over that can protect themselves, because many people don't think that's just something that's pediatric and it only affects children, but it lands many of our senior adults in the hospital. So as I would say, first, getting vaccinated. And then secondly, if sick and have a mild fever, stay home, or at least put on a mask to protect yourself and others. And then the other thing that we often want to instill, wash our hands often. Soap and water, 10 to 15 seconds, or some hand sanitizer. And let's try to avoid touching your face as much, especially if you are slightly ill. And ventilation, either cracking a window or filtering that air, even though it's a little chilly. So those air filters that were really popular, those HEPA purifiers that were very popular, that were marketed during times of COVID, bring that back out. That can actually help when you have a crowded indoor space and can reduce the amount of virus load kind of circulating from someone that may not realize they're sick, but that can also reduce some transmission. And then I have to say, get sleep. If you got time off, get your 7 to 9 hours, hydrate, balanced meals, and once again, check on your elders, people with chronic conditions, and those that are pregnant. Encourage them to get vaccinated as we go into the holidays. The more time we spend together, we do more than just share food and love. We share viruses.
Right. We also share conversations that can be kind of tricky during the holiday season, especially in a divided nation when it comes to politics. Any advice there?
Some people are really stuck in certain positions, and we want to try to avoid causing any significant familial conflict. I say sometimes you can't avoid it because it's a loved one and they're staying with you. I would always try to either see this as a teachable moment or try to understand their point of view. If you start getting into a heated discussion, getting angry, using expletives, slurs at someone, usually that's going to lead to someone shutting down. So this is sort of like communication 101, but try to see it from the other person's point of view. And if you can, stick to the facts.
We know that there are other health conditions that pop up during the holidays, specifically talking about heart attacks. More people have heart attacks over the holidays. So maybe we should take a minute and just talk about heart health.
Yeah, of course. So many people may not be aware that heart attack deaths are more likely during the winter holiday than any other time of year. Actually, more people will be afflicted or will die from a heart attack between the 25th of December and January 1st. Here are some quick tips that I would mind going over. So as you just alluded to, conversations, being around family can cause increased stress. So we are often consumed with shopping, cooking, finishing work deadlines. We also tend to eat and drink more during stressful events like the holidays. So although the holidays are meant to be filled with merriment and cheer, they can be stressful due to overindulgence. The other thing that is a risk factor is cold weather. So our blood vessels constrict during cold weather to keep our core temperatures high. And we get an increased inflammatory response. So when we get this increased inflammatory response, say from shoveling snow, this can lead to clots lodging in our blood vessels more easily, particularly our coronary blood vessels. So that's the vessels that supply blood to our heart. So we need to be mindful not to overdo it with strenuous activity when outdoors. Get that younger family member to clear. We don't need to have chest pain out of pride. But cold weather places increased strain on our hearts. And then last two, I would say, is a disruption in our normal health routines. So when people are focused on deadlines for work, shopping, trying to feed their family, right now with so many federal workers out, they may postpone many routine medical appointments and medication refills due to being distracted and just busy. This can often lead to us reducing our exercise regimen and also missing medications that control our blood pressure and cholesterol, thus increasing our risk for having a heart attack or angina. And then, of course, lastly, being overindulgent. If you are someone that has an underlying heart condition, you begin to eat more foods that are high in salt and fats, combined possibly with increased alcohol, this puts just even more strain on our heart and places you at increased risk. So I would say, and then lastly, understand the signs of a heart attack. Know the signs. So pain or discomfort in the chest, lightheadedness, nausea or vomiting, pain in your jaw, neck, or back, and discomfort or pain in one's arm or shoulder associated with shortness of breath. So I often encourage people, celebrate in moderation, plan for a peaceful time with yourself and others. So make time for yourself to relax. Once again, that's 7 to 9 hours of rest during the holidays. Keep moving, right? So after you've had possibly that heavy meal, we know that the American Heart Association recommends 150 minutes of physical activity every week. Going for a walk, bowling, after having that heavy meal, a mile and a half, that's often good. And the key is to avoid being sedentary during this time. So let's try to avoid stressful conversation. Let's try to avoid being sedentary. Let's try to not have as much salty or fatty food, or at least minimizing, especially if you're someone that has predisposing conditions that would lead to one having a heart attack. And once again, let's try not to cancel many of our medical appointments and make sure you get your meds refilled. Many pharmacies are closed over the holidays. And that's sometimes I often say, wow, why is your blood pressure so high? Oh, I haven't taken my meds in a week because I've been off. And in the ED, I often see that. So take care of your family, try to rest, just try to reduce the amount of argumentation or arguments that we may have. But more importantly, keep moving and try to stay with your routine for medication compliance, and get that younger person to clear that snow or that doing a significant exercise outside. I think a turkey trot is good, even walking.
Dr. Richard Ferguson is an emergency room doctor and the president of the Black Physicians of Utah.